to Cannabis in Focus, the show that helps you make informed decisions about the use of medical cannabis for yourself and your loved ones. We bring you a wide range of guests, from medical practitioners and scientists to producers and patients. Our goal is to clear up some of the misinformation around cannabis and bring this valuable medicine back to the mainstream where it has been for thousands of years. I'm your host, Miriam Knight, and today's guest is Dr. Jason McDougall. Dr. McDougall is a professor of pharmacology and anesthesia at Dalhousie University in Halifax. He has undertaken a new study supported by the Arthritis Society to find out if medical cannabis can help repair arthritic joints and relieve pain. The 3-year study is investigating if cannabis is not just dampening the pain in the brain, but also working to fight inflammation and repair the joint itself. Welcome, Dr. Jason McDougall.
Good morning, Miriam.
Good morning. It's such a pleasure to have you.
Thank you.
I'm fascinated by your research. Now, you've been studying pain, physiology, and pharmacology throughout your professional career. I'm curious as to how long you've been researching the effects of cannabis.
Yeah, we started this project probably about 12, 13 years ago. With a study with a colleague when I was researching in Calgary, where we wanted to discover whether cannabis could be useful for treating arthritis and joint pain.
Fascinating. And when did you become aware of the endocannabinoid system?
So we discovered the receptors for cannabis in the joint. We were the first to show that not only are these cannabis receptors in our brain, but they also occur in the periphery, and we were able to find them localized within the joint, and that's got an attractive edge to it, because it means there's the potential to be able to control pain and inflammation and nerve repair directly within the joint using different cannabis compounds, and therefore not maybe getting into the brain and having any of these sometimes undesirable psychoactive effects.
And when you say that you discovered them in the joint, I was looking at your research about cannabinoids and mouse arthritis, and I had this mental image of wee mice hobbling around with their wee arthritic knees smoking pot.
No smoking of mice, I can assure you.
That must have been quite a discovery. How did you actually, were you working with, I know Dr. Rafal Meshulam in Israel has also been working with them. Did you have any connection with that research?
Not with Dr. Meshulam at the time. We have since partnered together on some projects. No, this was a researcher called Keith Sharkey, who's in Calgary, who was researching cannabis and the cannabinoid system in the gut. And we got talking one day, and I said, well, what about joints? Nobody had ever looked at the joints before. And at the end of the day, the majority of people who are taking medical cannabis, I mean, in Canada, it's around about 60% of medical cannabis users are doing so for the alleviation of their joint pains. So it's a huge opportunity, I think.
It is indeed. What is the difference between how cannabis and opioids relieve pain?
That's a great question. That they have similar pathways, similar ways of doing so. Opioids are very effective at controlling pain. They can work in the periphery, that's to say outside of the brain. So they can actually act directly in tissues such as in joints or in the GI system, etc., to alleviate pain that way. But when they get into the brain, the opioids typically have more of a pain-altering effect. It alters the perception of pain. The cannabinoid system maybe doesn't do that to that extent, or it can obviously, alter some of the feelings of pain in the brain, but also, like I say, with our research, we're finding that it can act directly in the periphery and reduce the nerve impulses, those pain-sensing nerves, from actually firing and sending those signals to the brain.
Now, there are two receptors that have been identified, CB1 and CB2. Could you just distinguish their mode of action and which ones were the ones that you found in the knee joints or in the joints?
Sure. So CB1 is it's really mainly associated with nerves. So it's the most highly expressed receptor in the brain. So it's there for a very good reason, obviously. Whereas CB2 receptors tend to be more associated with immune cells and maybe helping with inflammatory processes. We've actually been able to localize both types of receptors in the joint. CB1, clearly, when we activate those receptors, we can reduce those pain-sensing nerves from firing, and we can reduce pain in our models of arthritis. The CB2 story is a little bit more complicated, and we're still not quite sure how CB2 is acting within the joints or how effective it can be.
What are the things that actually trigger pain?
Well, a whole host of different reasons can trigger pain. There are many different types of pain. Typically, when we think of arthritis, we think of inflammatory type of pain. So during an inflammatory flare or a patient who has arthritis in their joints, there's a release of all these different chemicals within the joint. Things like prostaglandins, the various different neuropeptides and things like that, and they all act on those sensory nerves in the joint to make it hypersensitive. The nerve now fires at a higher rate than it would normally, and the brain would interpret those electrical signals as pain. So that's really the derivation of pain within the periphery, with inflammatory pain. Now, there's also another type of pain called neuropathic pain, which arises due to damage to the nerves themselves. And so this is a very difficult type of pain to diagnose and to try and treat. But once again, we're finding that cannabinoids are extremely effective at treating both of these different types of pain.
When you say cannabinoids, we're talking about the endocannabinoids and also cannabinoids from the cannabis plant. Which ones work on which receptors?
So there are over 100 different types of cannabinoids within the cannabis plant. So there's a huge number that we're just slowly making our way through to see what each of them in fact do. The endocannabinoids are, of course, the ones that are naturally formed in our body, and so they're things like anandamide and another chemical called 2-AG and a host of other ones. And we're just slowly starting to piece out the pharmacology. If we think about THC, of course, in the cannabis plant, that primarily works through CB1 receptors. And as I said before, since CB1 receptors are highly expressed in the brain, those are the receptors that are involved in the psychoactive effects of that particular compound. There are a whole host of other, as I said, different cannabinoids, and we're just slowly piecing together which receptors they interact with.
Does stress, for example, really make pain worse, or does it only feel worse? Is there any difference?
Yeah, I mean, when people are living with a chronic pain condition, obviously there's a lot of anxiety associated with that, a lot of stress, and there's very good clinical and preclinical research out there to show that, these negative affective behaviors can impact how much pain a patient will actually feel and report. So yes, they certainly have a negative impact on our pain sensations.
So do you actually control the pain and inflammation by affecting the nerves or through some other mechanism?
One of the ways that we've looked at is by affecting the nerves directly. So if we take a selective cannabinoid that can act on the CB1 receptors just solely within the joint, what we found is that we can reduce the firing rate, or how many electrical impulses those pain-sensing nerves will be able to send to the brain. And so we're able to locally reduce the pain using cannabinoids within the joint that don't get into the central nervous system, and you don't have any of those undesired side effects associated with them.
Why do people experience phantom pain after an amputation? Can cannabis stop it?
That's a very huge area about the whole phantom pain, and we're just slowly starting to piece together how phantom pain comes about. What happens, we think, is that there are plasticity changes occurring, particularly within the spinal cord, but also within the brain. So if you could imagine, if you're having years of pain being developed, and then that limb is suddenly no longer there, these plasticity changes that have occurred in the central nervous system persist, and so you still feel like you have that type of phantom pain, even though the limb or whatever is missing. And certainly cannabis or certain types of cannabinoids could be effective within this, and I'm particularly thinking of cannabidiol, that non-psychoactive component in cannabis. Has been found to be very effective at controlling pain. It helps repair nerves and can reduce that neuropathic type of pain, that phantom pain can be associated with it.
So is that its mechanism of action, that it actually repairs the nerve?
Yes, that is one of its mechanisms of action. Yeah, we found that in arthritis as well, that the nerves in our joints become damaged. So the nerves will fire naturally, and even when the patient's at rest, and that neuropathic pain can certainly be reduced by treating with cannabidiol. I think we need more clinical studies, however, to back up some of the things that we're discovering in the lab.
What actually happens to a nerve when it becomes arthritic?
What we're finding is that it starts to lose its coating, so it has this sheath, this coating around the nerve. What we've found in an arthritic joints is that these nerves lose that coating. They then become exposed. They can undergo further damage, and the whole shape and form of the nerve can change. And you can imagine that these malformed, naked nerves, if you like, are suddenly firing at high rates, and you get those feelings of neuropathic pain.
So if CBD can help that, then presumably it could help other demyelinating diseases?
Absolutely, and there was some good evidence out there that CBD has been effective for the treatment of multiple sclerosis, for example, where there's a lot of this demyelination and nerve damage occurring. So this research can certainly be applied to other neurodegenerative diseases.
What are the differences among rheumatoid arthritis, osteoarthritis, and joint injury in terms of what causes the pain?
So this is, again, work that we've been trying to fathom for the last 20 years. It's a very complicated process. So with rheumatoid arthritis, it's primarily an inflammatory disease. It's an immune disease. So some of those inflammatory mediators that I was referring to earlier on can, sensitize those nerves within the joint, leading to pain sensation. The immune system can also directly interact with these peripheral nerves, leading to this sensitization process and pain. When you get into osteoarthritis, it's a very complicated subset of different types of pain we're finding. Some patients may have that inflammatory component that I've just described. Other patients might have that neuropathic component where there's damage to the actual nerves. And then you have all this degradation going on in an osteoarthritic joint, which can activate the nerves directly through loading of the joints. Mm-hmm. So there's maybe not one particular drug that's going to help osteoarthritis pain. It may be, and we have to subtype different patients based on the types of pain that they have, and treat them accordingly.
So the mechanisms for osteoarthritis and trauma are quite similar.
For trauma, again, yes, there's a lot of similarity. At least in the early stages of osteoarthritis, a lot of those features can be associated with the post-traumatic joint.
Now, you said that cannabinoids can actually heal the underlying causes, which is in contradistinction to what opioids do. They only suppress the pain. How have you observed the healing? Is it remyelinization of the nerves?
So that's right, Miriam. That's one of the aspects. We've found this recoating, this remyelination of nerves seems to be beneficial. We've found that cannabinoids can, again, locally be anti-inflammatory, so they can reduce some of those inflammatory processes that are associated with arthritis. And other people have shown that it can help reverse some of the destructive effects of arthritis. There was a great study done back in 2001 now, where they found that cannabidiol can actually reverse the structural damage that occurred in a model of rheumatoid arthritis. So they're really very powerful drugs.
They certainly seem to be. You have clearly been working with animal models. Have you done any human experiments as well?
I personally have not, and this is, I think, a big gap in the whole research area with cannabinoids and medical cannabis, is that there really are relatively few clinical trials being carried out, or clinical studies being carried out looking at the effects of cannabis on different diseases. I know in the arthritis world I can list on one hand the number of trials, clinical type studies that have been conducted looking at cannabis and the cannabinoids. However, I know of some studies that are ongoing that are looking into different types of cannabis and their benefits for osteoarthritis pain. So vaping of different strains of cannabis with known different concentrations of CBD versus THC and their effect on pain. And quality of life for the patient as well, of course. So these are in the very early stages, and I can't wait to see what these guys are going to come up with.
The legal climate in Canada has just undergone some major shifts. Do you expect the pace of research with human subjects to be taking off now?
I'm hopeful. I'm hopeful of that. We've had medical cannabis has been legal in Canada since 2001. But now with the legalization of the recreational side of things coming July of this year, I do expect, it's back in focus, it's back in vogue. I think the government realizes that research has to be continued to be done on cannabis and the cannabinoid system. So I'm very hopeful that we'll hear some positive news. And I think there's actually a budget today, so I'm going to be keeping my ear close to the
Get those grants.
Yes, for sure.
Absolutely. Are your American colleagues jealous of the climate, the academic climate difference in Canada?
I'm not sure I would say they're jealous. I know a lot of my American colleagues are doing fantastic work down in the States, looking at cannabis and preclinical and some clinical studies and things as well. I think maybe the slight freedom that is occurring in Canada is maybe hopefully going to be facilitating research in the future. It's crazy. More than any other compound or any other drug that I've worked on, cannabis always just seems to get this smiles of derision about it, and it's. We can talk about the whole social history of cannabis use for medical purposes. But I think it's unwarranted, and we just need to destigmatize this whole area by doing good research.
I couldn't agree with you more. Your lab uses an integrative approach in studying nerves and pain. What other disciplines do you bring into it?
So we have an interest in inflammation as well. So we use various different techniques to measure how the white blood cells interact in an inflamed joint. We know that during inflammation, these white blood cells are obviously accumulate to the joint. They stick to the blood vessels. They squeeze out of the blood vessels and into the tissue, and then release some of these chemical mediators that can cause the inflammation and also cause the pain. So we have an interest in looking at the inflammatory processes, as well as some of that nerve repair processing as well. We're slowly finding some exciting data with respect to these cannabinoids repairing sensory nerves.
So is inflammation always mediated by the immune system?
It is the main contributor to inflammation is our immune system, yes, for sure.
Uh-huh. Are there any other types of pain that can be helped by cannabis?
Just the ones that I mentioned, the inflammatory types of pain, the neuropathic pain arising from nerve damage, also this nociceptive pain, which is if you've got a damaged joint, the loading of the joint can directly activate those nerves. And again, we've found different components in cannabis to be effective at reducing all of these different types of pain.
I actually had to look up nociceptive, so I know what it means.
Okay, good.
But could you explain for our listeners?
Well, it's nociceptive pain is, for example, if you stand on something sharp or your hand touches something hot, you have that immediate acute reaction that you withdraw away from that type of pain. It's a very protective sort of pain. Sorry.
It's the reaction of the body to avoid further damage.
Exactly. Avoid that noxious stimulus and get away from it as quickly as possible. So it's very rapid.
Do you have any notion of what might be the next big breakthroughs in cannabis research?
I think looking at drug-to-drug interactions is going to be very important. So we hear about the opioid sparing effect of cannabis, and I think that is really exciting. Understanding how cannabis interacts with other drugs and may be able to reduce the dosage of the other drugs such as opioids, I think is going to be fascinating. And I think that more work into the endocannabinoid system, so our body's natural cannabinoids, we know that they're broken down very rapidly by very specific enzymes. And there are drugs being developed that can reduce the enzymatic breakdown of these endocannabinoids. So it's really a means of boosting our own pain-relieving system. I think that the future research into that area is also going to be exciting. And then finally, there's over 500 different chemical components within the cannabis plant. Do all of them do something therapeutically? So we know about all the different terpenes and the flavonoids that are in cannabis that give them the specific smells. Could they actually have therapeutic value? And there's some emerging research to show that indeed, yes, they do. And so I think that's going to be exciting to uncover that area in the future.
I know that science tends to want to discover the active component of, whatever drug they're working on and to isolate it. But I think it was Meshulam who talked about the entourage effect that you're alluding to with the inclusion of terpenes and flavonoids. In fact, I heard one talk that felt that the terpene profile was as important or even more important than the THC to CBD ratio. Have you been using that in your own research?
Actually, we have. You're quite right. A lot of the evidence is still quite anecdotal, though. Some medical cannabis users prefer a particular type of strain of cannabis, I understand, just because based on the smell of it. Mm-hmm. And that will, of course, be related to the terpene content of that particular strain that seems to work for them. We've started doing some work looking at the terpenes, and so we've been looking at humulene and beta-myrcene, and the emerging evidence so far seems to be showing is that some of these terpenes can actually have some relatively moderate anti-inflammatory and anti-nociceptive and pain-relieving effects. It's exciting.
Very exciting. And do you have any new areas that you're coming around to investigating?
Certainly, we're interested in these terpenes and seeing how they would interact with the endocannabinoid system in our bodies. Mm-hmm. We're looking at interactions between our endocannabinoids and maybe other commonly used drugs like the non-steroidal anti-inflammatories that a lot of arthritis patients are on. What does that combination actually do to the joint and due to the pain? Can we reduce the amount of non-steroidals, anti-inflammatory drugs that a patient would take? And again, that would have great benefit because being on these NSAIDs for a long period of time, we know can have detrimental effects in the cardiovascular system, as well as maybe causing ulceration or bleeding in the stomach. So again, bringing cannabis or boosting the endocannabinoid system would potentially allow us to reduce the NSAID intake, things like ibuprofen, etc., and maybe save a lot of lives.
Absolutely. You mentioned, I forgot the term that you used, the combination of cannabinoids and opioids, it spares the opioid. What did you mean by that? That it prevents you from developing an accommodation to the opioids so that you have to keep on taking more and more?
Yes, there's some evidence out there that people who are taking medical cannabis can actually start to reduce the amount of opioids that they take, so they don't need as much of the particular opioid to help deal with their pain. And so that's the sparing effect. And again, that can only be a great thing from a standpoint of dependence, potential addiction issues, but also some of the other known side effects of opioids like the cardiorespiratory depression, etc.
Well, I can't thank you enough for all of this fascinating information. I have run out of my prepared questions because you are so concise and precise in your answers.
Oh, thank you. That's good to know.
Well, I look forward to following your research, and I hope to revisit our little conversation perhaps in 6 months or a year and see what you've come up with next.
Perfect. I'd love to do that, Miriam. Thank you.
Thank you so much, Professor Jason McDougall from Dalhousie University. Goodbye.
Bye.
And thank you for listening. I'm Miriam Knight for Cannabis in Focus. Do visit our website at cannabisinfocus.com. Goodbye.